Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. Leg cramps. What do you need to do when you get leg cramps? So stay tuned. All right, leg cramps. How many times have you woken up in the middle of the night with the cramps in your leg or your toes or something like that? We'll talk about what you need to do when it happens, but to address the cause is the reason why you should look into your nutrition, which has to do with magnesium and your vitamin D as an example. So that's beside the point. At this point, all I want you to know is when you get cramps in your leg, as an example right here, you want to, the tendency is you grab it and go ow, ow, like that. But the reality is it's cramping. So you need to actually go with a direction of what that muscles would do when it normally contracts. So your leg muscles in the back, the function of it is to do this, toes down. So instead of grabbing it or grabbing your foot and trying to pull it up, which actually is going against what the muscle is trying to do, you go in the direction it would go. So when you get a leg cramp, grab it firmly, grab your foot and gently, that's the key word here, gently push it in the direction with the toes down. When you do that, the cramp doesn't last as long, and the next day or 2 days later, it's not sore as it normally would be otherwise. So look into your nutrition, and then once the cramp's over, the next day or the day after that, gently try to passively stretch it. To passively stretch, that means you grab the foot with your opposite hand and you try to go through the movement of toes down and toes up. When it's toes up, you're actually stretching the leg muscles. So you go through the full range of motion with the toes up that way. Then you progress into what's called active exercise, where my suggestion is to be sitting down and simply going on your toes without any weight bearing. So you go up and you bring the legs down, the heels down, and you go up like that. And finally, when you load the joint and you go up and you come down. So if you're thinking, oh, I must have gone for a strenuous activity and that's caused it, well, bottom line is you were not on one foot, you were on both feet. So that's an indication that there is an imbalance, and definitely nutrition is something you need to look into. Thank you for watching. If you like what you saw, please subscribe to my YouTube channel. And now I have a podcast you should look into. It's called Life and Health Matters with Dr. Shakib. It's on Spotify, Apple Podcasts, and Google Podcasts. Once again, thank you for watching how to take care of the leg cramps, and stay in touch. Take care.